All right, shall we? We have about 12 participants. Our participants, you're welcome to this webinar. Dr. Janet.
Okay.
Janet.
Fred.
Yeah, I think we can start.
All right. Awesome. Yes, we do have 13 participants. I think we can start now. So you're all welcome to this webinar, the very first ever Ask the Anesthesiologist webinar. And this has been put together by the Association of Anesthesiologists of Uganda, which title speaks for itself. So we are doing this for the first time ever as, the AAU, the Association of Anesthesiologists in Uganda, to celebrate the World Anesthesia Day, which is a day that's celebrated all over the world on the 16th of October, and it's also known as the National Ether Day. Basically, what happened on this day was a number of years ago, in 1846, on the 16th of October, the first public demonstration of the use of an anesthetic to perform in a surgical procedure happened. And so from that day onwards, we celebrate this day because that meant a great breakthrough, not just in medicine, but also in the field of surgery and generally in patient care, to ensure that, patients are able to undergo surgery in a pain-free and comfortable manner. So that's why we're doing this today. And we're glad to finally involve the rest of the public this time around. We get a lot of questions about anesthesia and what it means, and there's so many dogmas surrounding it and so many uncertainties. So you're all very welcome, because today we hopefully can answer a lot of your questions and help to allay a lot of anxieties and uncertainties surrounding the field of anesthesia. So you're very welcome. My name is Dr. Nordrine Ayupo. I am a cardiac anesthesiologist, and I'm happy to moderate this session today. I will let the other moderators introduce themselves, and we'll eventually get our panelists to introduce themselves as well. So thank you, and once again, you're very welcome. Janet and Fred.
Thank you very much. My name is Dr. Janet Tumukunde, pediatric anesthesiologist, lecturer at Makerere University. You're very welcome to this very first session. I will be a moderator for this session alongside Dr. Fred. And so we'll have our panelists, Dr. Elizabeth Igaga, Dr. Arthur Emoru, Dr. Aggrey Lubikire, and Dr. Arthur Kwizera. So I will ask Dr. Elizabeth Igaga, who is the anesthesiologist at the Uganda Heart Institute and lecturer with Makerere University, to give a brief about herself and also introduce us to general anesthesia.
Thank you, Janet. Thank you, Dr. Janet. My name is Elizabeth Igaga. I am an anesthesiologist working at the Uganda Heart Institute, but I'm also a lecturer at Makerere University in the Department of Anesthesia. I also have an interest in patient safety, which basically is to ensure that you have an anesthetic that doesn't harm you and you end up leaving the hospital safe, happy, and comfortable, and pain-free as well. So my job today is to talk about general anesthetics, which I will try and be inclusive with everyone, but basically it's where people are put to sleep to ensure that, one, they are not aware of what's going on during their surgery, and two, that they are pain-free. So what happens is you have drugs that are administered to you, and these drugs can be given to you either through your veins or through, you can breathe the drugs in Luganda, and the local language, we call it caliform. But basically, it's not chloroform, but yes, we call it caliform. But basically, these are modified gases that, for lack of a better word, knock out your brain until the surgery is over. So the reason for this is basically what we want to do when we are giving any anesthetic is to make sure that the part of your body that is having surgery or has pain is numbed enough so that you don't feel it. Of course, if we're operating on your head, it would be very difficult for us to numb just that part of your body. So we'd have to put you completely to sleep. A lot of people who I have spoken to basically keep saying, oh, you want to put me to sleep? Does that mean I will not wake up? What if I don't wake up? There are a lot of concerns with the public, either from experience previously or from what they've heard about what general anesthetic does and whether you will actually wake up from it and what that means. So anesthesia generally, but in particular general anesthesia, when administered by someone who is trained and competent, such as the anesthesiologist, but we also have anesthetic officers who administer anesthetics, generally should be safe. When I say safe, I don't mean it's without risks. I mean, it should be safe. One, because people are trained to use these drugs. They know the doses to give. They know not to give you an overdose. And the most important thing is that while you're having the anesthetic, they are there with you and they watch you. So so the idea is to make sure that this is safe. So what risks are there? Of course, the biggest risk that people don't want to talk about is the fact that the patient could actually die. I start with the worst because I think that's one of the biggest concerns. The patient could die. The chances that that would happen are lower now than they were previously. Why? Because we have many more drugs that are safer. We have people who are trained and have been trained more than new techniques of doing the same thing that was done years ago in a much safer manner. We are able to monitor you a lot better with the technology that we have. And so the risks are significantly reduced, but they're still there. A lot of the things, most of the times when I'm speaking to my patients, I tell them, partially, when you leave your house to go, say, to work, there's a chance that you will have an accident. And there's a chance that that accident could just be a minor accident where you'll pick yourself up and go back to work. Or there's a chance that you could actually die from that accident. But you still wake up every day, dress up, leave your house, and go to work. So is anesthesia risky? Is a general anesthetic risky? Yes. Are there things that we do to prevent that from happening? Absolutely. I think that this discussion is longer than the time I have been given, but I'd just like to say that people do wake up from general anesthetics. Most people that not wake up from general anesthetics. There are risks and benefits of a general anesthetic versus anything else. But I'd also like you to know that as our job as anesthesiologists is to make sure that when you have your anesthetic, you're comfortable, you are pain-free, and you are safe. And safe is one of the biggest things on our list of things to do. So with that, I will hand over to the moderators. Thank you.
Thank you, Dr. Elizabeth. And in the same spirit, we'll move on to Dr. Arthur Emoru, who is also an anesthesiologist at the Women's Hospital and in Jinja, and he will introduce himself and also give us a brief introduction on labor analgesia. Dr. Emoru.
Thank you, Dr. Janet. My name is Dr. Arthur Emoru. I am an anesthesiologist with specialist training in obstetric anesthesia and an interest in painless labor. I'm going to talk about labor analgesia. When we talk about labor, we're meaning childbirth, not any other form of labor. So childbirth is painful. It's mentioned in the Bible for Bible-believing people. God said that the woman would have painful labor, but that's a discussion for another time. But also there are methods of controlling that pain. The pain that is involved in childbirth varies from woman to woman, and it varies from from pregnancy to pregnancy, even in the same woman. Generally speaking, the first pregnancy is most painful in most women. The subsequent pregnancies are compared to the first are less painful, but pregnancy is still